Well, hey there. This is Andrew Gorecki from Superior Physical Therapy, and on this month's newsletter to all of our past patients, our fans who really care about their health, I want to talk about arthritis. And in this video, this is really talking about the number one single biggest myth about arthritis that people in general hold. And this is not just the general population, but this is also a lot of the medical community. The number one biggest myth about arthritis is that it causes pain, right? We think, well, I have arthritis, therefore I have pain. And what I want to do today is show you some evidence that proves that arthritis in every joint in the body, there's research now that's relatively new that proves that arthritis does not equally or directly cause pain. So you can see my screen here. This is an image from a research article in the Journal of Neuroradiology in 2015. This was a systematic review. A systematic review looks at a bunch of different studies about the same topic, sometimes hundreds of studies, and then summarizes the results. So it's a very high level of science. It's the highest level of research you can find. So this is a study called the asymptomatic imaging. So what they did is they took people, thousands of people, tens of thousands of people of all different ages, ranging from 20 to 80, and the only qualification that they had to have in the study was they had no pain. So they were pain-free people. And in this case, they looked at imaging, X-rays and MRIs of the spine, so from the neck to the lower back. And the results are fascinating. So we can look at the first row here, which is called disc degeneration. That's the same thing as calling somebody having arthritis in their spine, or stenosis of the spine, or degenerative disc disease, joint space narrowing. It is arthritis. And you can see that people that were pain-free at the age of 20, 37% of those people had disc degeneration or arthritis in the spine. At the age of 30, 52% showed that on imaging. And if we go all the way to the age of 60, you can see 88% of the people in the study who had no pain had arthritis in the spine on an image. At the age of 80, 96% of people had it without pain. So if we had arthritis in the spine, and that was the cause of pain, then the majority of people with it on an image would have pain. And this study shows that almost everybody gets it as we age. It's part of natural aging. So that's the first piece of evidence I want to share with you. So if you are thinking to yourself, well, I was told I have arthritis and that's why I have pain, I'm here to tell you that in the spine, that study shows that it's not true. You can have arthritis without pain. You can have arthritis with pain. But it is not the cause of the pain. There is something else going on in the body that's causing you to have pain in your back in that case. Now, this is another asymptomatic imaging study. This is actually 5 different studies, much smaller on scale, but it looks at different regions of the body. So let's look at the neck. Again, these were people without symptoms. This is 1,200 people without symptoms. They gave them an image. What they found was, in their 20s, 75% of those people had a disc bulge. Right? That's a lot of people without pain. So there you go. Of the 1,200 people, 87% of those people had a disc bulge in their neck without pain. So the majority of the people that were studied that had no symptoms had a disc bulge, which is a little different than arthritis. But again, let's move down to the lower back. This is looking at over 3,000 people that are pain-free. And at 50 years old, 80% had disc degeneration, which is arthritis in the spine. So 80% of those people, and this is again from the Journal of Neuroradiology 2014. If we move down to the knee, we had 44 people that had no symptoms, ages 20 to 68. 43 of those people had a meniscus abnormality. And let's see, these other injuries in the shoulder, same story. This is talking about a labral tear in the hip and the shoulder, which is a little different than arthritis. But the point is that we cannot use just imaging to diagnose ourselves with arthritis and then think that's the cause of pain. Here's another one. We had a study that had the same patient. This was a study that was published in, let's see, what is this study? What is the journal called? The the Spine Journal in, the Spine Journal in 2017. The study title is Variability in Diagnostic Error Rates of 10 MRI Centers. So the same patient was given 10 MRIs in different facilities, right? So a 63-year-old woman with history of low back pain and sciatica. So 10 different MRIs of the lower back, and here's the results. 49 distinct findings from 10 reports, meaning 49 unique findings. None of the 49 findings reported unanimously. 32.7% of the findings only appeared once across all studies. So the conclusion is where a patient obtains an MRI exam and which radiologist interprets the examination may have a different impact on radiological diagnosis, subsequent choice of treatment, and clinical outcomes. Right? So the MRI in this case is one piece of the puzzle, but it is not going to give you the cause of your pain. They're not reliable. It's to interpretation. Here's another study on the foot. This is from the, let's see. Oh, there's a bunch of different studies here. You can see them in the italicized lines. Let's look for anywhere that says arthritis. All right, so this one does not show arthritis, but it does show lots of abnormalities that, again, are asymptomatic imaging. So you can have these abnormalities without symptoms. We've got one more here of the full body, and let's look at, here we go, in the knee. There was over 5,000 people that were imaged without pain, and what they found was people that were under the age of 40, there was a 19% chance they had arthritis without pain, and over 40, there was a 43% chance that they had arthritis without pain. Again, going to the spine, disc degeneration is the same thing as arthritis. 3,000 people on this review in 2015. 37% of 20-year-olds had disc degeneration and 96% of 80-year-olds. So there you go. There's studies that prove that the number one biggest myth about arthritis is that it equals pain. So if you're out there struggling with arthritis and you have pain, you've been told that's why you have pain, I'd encourage you to open up your mind a bit more and recognize that most likely it's not arthritis that's causing your pain. It's something else in your body, the way you're moving, that's creating stress and damage to your tissues. Hope you enjoyed this and you have a great day.